What is the recommended method for chest compressions in infants when two rescuers are present? A. Two-finger technique on the lower sternum. B. One hand over the chest, one supporting the back. C. Thumb encircling hands technique. D. Palm of one hand on chest. Answer: C. The thumb encircling technique improves compression depth and consistency in two-rescuer infant CPR. If an AED detects a shockable rhythm and delivers a shock, what is the next immediate step? A. Check for a pulse. B. Give rescue breaths. C. Resume chest compressions immediately. D. Wait for rhythm analysis. Answer: C. CPR should be resumed immediately after shock, starting with compressions. In a BLS scenario, how should rescuers treat a patient with a pulse but no normal breathing? A. Start compressions. B. Deliver one breath every 5 to 6 seconds. C. Deliver one breath every 6 seconds. D. Initiate defibrillation. Answer: B. Give one breath every 5 to 6 seconds to support breathing without compressions since the heart is still beating. Why is minimizing interruptions in chest compressions important during CPR? A. Increases ventilation. B. Avoids fatigue. C. Increases coronary perfusion pressure. D. Prevents rib fractures. Answer: C. Continuous compressions maintain adequate blood flow to the heart and brain. During high-quality CPR, how should the chest recoil be managed? A. Compress deeply without full recoil. B. Apply pressure during relaxation phase. C. Recoil is not important. D. Allow full chest recoil between compressions. Answer: D. Complete recoil allows the heart to refill between compressions. For a choking adult who becomes unresponsive, what is the next best step? A. Deliver abdominal thrusts. B. Attempt blind finger sweep. C. Begin CPR starting with chest compressions. D. Give rescue breaths only. Answer: C. Start CPR immediately. Chest compressions may dislodge the object. Which of the following is a sign of effective rescue breathing? A. Air entering the stomach. B. Audible chest compression sounds. C. Visible rise of the chest. D. Gasping respirations. Answer: C. Visible chest rise confirms air is entering the lungs. Which action is not part of high-quality CPR for an adult? A. Compress at a rate of 120/140/min. B. Allow full chest recoil. C. Minimize interruptions. D. Compress at least 2 inches. Answer: A. The correct compression rate is 100 to 120 per minute, not more. What should be done if the chest does not rise during the first rescue breath? A. Reposition head and attempt second breath. B. Continue compressions. C. Deliver a second breath with more force. D. Apply abdominal thrusts. Answer: A. The airway may be blocked. Retilt the head and retry. A patient has agonal gasps but no pulse. What should the rescuer do? A. Wait for normal breathing. B. Monitor only. C. Begin CPR immediately. D. Give one rescue breath every 10 seconds. Answer: C. Agonal gasps are not normal breathing. CPR is indicated. For a child victim with a pulse below 60 BPM and signs of poor perfusion, what is the next step? A. Give oxygen only. B. Begin chest compressions. C. Deliver AED shock. D. Wait until pulse stops. Answer: B. In children, a heart rate less than 60 with signs of poor perfusion requires CPR. How is CPR modified for pregnant women? A. No changes. B. Use abdominal thrusts. C. Perform manual left uterine displacement. D. Avoid AED. Answer: C. Manual displacement of the uterus relieves pressure on the vena cava. What is the compression depth for children in CPR? A. About 1 inch. B. At least 2 inches. C. 2.5 inches. D. 1/4 chest depth. Answer: B. Compressions should be about 2 inches, 5 centimeters in children. Which BLS step follows confirming scene safety? A. Begin compressions. B. Open airway. C. Check responsiveness. D. Give a breath. Answer: C. After ensuring the scene is safe, check the victim's responsiveness. When using a bag mask device for two-person ventilation, how many rescuers are needed and what are their roles? A. One person holds the mask and squeezes the bag. B. One seals the mask, one squeezes the bag. C. One uses mouth to mask. D. Two seal mask, third compresses. Answer: B. The first seals the mask with 2 hands, the second squeezes the bag. What is the best way to check for breathing in an unresponsive person? A. Look for skin color. B. Place ear near nose and mouth. C. Feel for chest temperature. D. Shake the victim. Answer: B. Look, listen, and feel for 10 seconds for normal breathing. What should you do if an AED says no shock advised? A. Check battery. B. Remove AED pads. C. Resume CPR immediately. D. Wait for further instructions. Answer: C. Resume CPR if no shock is advised. What's the recommended ventilation rate with an advanced airway in place during CPR? A. 2 breaths every 30 compressions. B. 1 breath every 5 seconds. C. 1 breath every 6 seconds with continuous compressions. D. 2 breaths every 15 compressions. Answer: C. Ventilate every 6 seconds while continuing compressions without pause. During BLS, when should pulse checks be limited to no more than 10 seconds? A. Before compressions begin. B. After each shock. C. After 2 minutes of CPR. D. All of the above. Answer: D. Pulse checks are time-sensitive and must not delay CPR. When performing chest compressions on an adult, what is the correct hand placement? A. On the lower half of the sternum. B. On the upper abdomen. C. Directly over the xiphoid process. D. On the left side of the chest. Answer: A. Compressions should be delivered on the lower half of the sternum, avoiding the xiphoid process. How deep should chest compressions be for an adult victim during CPR? A. At least 1 inch. B. About 1.5 inches. C. At least 2 inches. D. No more than 1 inch. Answer: C. Compressions should be at least 2 inches, 5 centimeters, deep to generate adequate circulation. What is the compression to ventilation ratio for adult CPR with a single rescuer? A. 15:2. B. 30:2. C. 5:1. D. 20:2. Answer: B. A single rescuer performs 30 compressions followed by 2 breaths. What is the recommended rate for chest compressions per minute for any age? A. 60 to 80. B. 80 to 100. C. 100 to 120. D. 120 to 140. Answer: C. Effective compressions should be 100 to 120 per minute. When should rescuers switch roles in two-rescuer CPR for adults? A. Every 1 minute. B. After 10 cycles. C. After 5 minutes. D. Every 2 minutes or 5 cycles. Answer: D. Rescuers should switch roles every 2 minutes to prevent fatigue. What is the first step when arriving at a scene where a victim may need CPR? A. Start compressions. B. Check for a pulse. C. Check scene safety. D. Apply AED. Answer: C. Ensure scene safety before approaching or treating the victim. What is the appropriate compression depth for infants in CPR? A. At least 1/3 the chest depth, about 1.5 inches. B. No more than 1 inch. C. 2 inches. D. 1/4 the chest depth. Answer: A. For infants, compress at least 1/3 the AP diameter, approximately 1.5 inches, 4 centimeters. How often should rescue breaths be given in a patient with a pulse but not breathing? A. Every 3 seconds. B. Every 5 seconds. C. Every 6 seconds. D. Every 10 seconds. Answer: C. Provide 1 breath every 6 seconds, 10 breaths per minute. What is the correct method to open the airway of an unresponsive patient with no suspected trauma? A. Jaw thrust only. B. Tilt chin lift. C. Finger sweep. D. Chin pinch. Answer: B. The head tilt chin lift is the preferred method unless spinal injury is suspected. Which of the following actions can reduce the risk of gastric inflation during rescue breaths? A. Giving large breaths. B. Delivering breaths rapidly. C. Using a barrier device. D. Providing each breath over 1 second. Answer: D. Each breath should be delivered slowly over 1 second to reduce air entering the stomach. In what situation should you withhold compressions in a pulseless victim? A. If agonal respirations are present. B. If the victim has a DNR order. C. If cyanosis is present. D. If the AED is charging. Answer: B. A valid do not resuscitate DNR order indicates CPR should not be performed. What is the main reason high-quality CPR is emphasized in AHA guidelines? A. Reduces hospital stay. B. Increases drug effectiveness. C. Prevents rib fractures. D. Improves survival and neurological outcomes. Answer: D. High-quality CPR increases chances of survival with good brain function. Which of the following is the most accurate method to confirm effective compressions? A. Audible clicks. B. Visible chest rise. C. Presence of carotid pulse during compressions. D. Color changes in the skin. Answer: C. Feeling a pulse during compressions shows adequate cardiac output. If you suspect opioid overdose and the patient is unresponsive with no pulse, what should you do first? A. Administer naloxone immediately. B. Deliver rescue breaths. C. Wait for EMS to administer drugs. D. Begin CPR and use AED. Answer: D. Begin CPR immediately. Naloxone can be given when available, but compressions come first. Which of the following best describes the importance of early defibrillation? A. Decreases compression rate. B. Improves ventilation rate. C. Increases survival in shockable rhythms. D. Reduces rescuer fatigue. Answer: C. Early defibrillation improves survival in ventricular fibrillation and pulseless VT. What is the preferred AED placement for an 8-year-old child with a pediatric dose available? A. 1 pad on each arm. B. 1 pad on chest, 1 on back. C. Both pads on chest. D. Both pads on back. Answer: B. Anterior-posterior placement ensures safe and effective energy delivery in small children. Which one of the following rhythms is shockable during cardiac arrest? A. Pulseless electrical activity. B. Asystole. C. Ventricular fibrillation. D. Sinus bradycardia. Answer: C. Ventricular fibrillation is a shockable rhythm requiring defibrillation. For a child needing CPR, which pulse should you check first? A. Carotid or femoral. B. Radial only. C. Apical. D. Popliteal. Answer: A. In children, the carotid or femoral pulses are easiest to assess during an emergency. What is the purpose of the CAB sequence in CPR? A. To reduce ventilation time. B. To prioritize chest compressions. C. To allow AED use first. D. To assess consciousness. Answer: B. CAB prioritizes compressions, airway, and breathing, emphasizing circulation. What is the maximum recommended pause between chest compressions for delivering rescue breaths? A. 10 seconds. B. 15 seconds. C. 20 seconds. D. 5 seconds. Answer: A. Pauses in compressions should be minimized and never exceed 10 seconds. If you witness a sudden collapse in a middle-aged adult, what is your first action? A. Begin CPR. B. Activate EMS and get AED. C. Give rescue breaths. D. Roll victim onto side. Answer: B. First, call EMS and get an AED, then begin CPR if no pulse. What compression technique is used for a single rescuer performing infant CPR? A. Heel of one hand. B. 2 thumb encircling. C. 2 fingers in center of chest. D. Abdominal thrusts. Answer: C. Single rescuer infant CPR uses 2 fingers just below the nipple line. What does high-quality CPR emphasize in terms of compression fraction? A. As close to 100% as possible. B. At least 60% of total time. C. 50% of total time. D. No more than 20%. Answer: A. High-quality CPR aims for a compression fraction of 80% or higher. What does high-quality CPR emphasize in terms of compression fraction? A. 50% of total time. B. At least 60% of total time. C. As close to 100% as possible. D. No more than 20%. Answer: C. High-quality CPR aims for a compression fraction of 80% or higher. During CPR, what is the significance of full chest recoil? A. Maintains AED rhythm. B. Allows air entry. C. Prevents rescuer fatigue. D. Promotes heart refilling. Answer: D. Full recoil enables the heart to refill between compressions. What is the most common cause of cardiac arrest in children? A. Myocardial infarction. B. Trauma. C. Respiratory failure. D. Stroke. Answer: C. Unlike adults, children often arrest from respiratory issues, not cardiac. What role does capnography play during BLS with advanced airway? A. Measures oxygen saturation. B. Confirms effective ventilation and perfusion. C. Detects chest wall compliance. D. Delivers shocks. Answer B. Capnography helps assess CPR effectiveness by monitoring CO2 levels. Why is it important to avoid excessive ventilation during CPR? A. It may decrease coronary perfusion. B. It causes bradycardia. C. It increases blood pressure. D. It improves cerebral oxygenation. Answer A. Excessive ventilation can increase intrathoracic pressure and reduce venous return. After AED shock delivery, what is the next best step? A. Reanalyze rhythm. B. Check for breathing. C. Immediately resume chest compressions. D. Wait for AED instruction. Answer C. Resume compressions immediately after a shock to maintain perfusion. How do you verify effective chest compressions during CPR? A. Presence of carotid pulse after each breath. B. Audible clicks from the sternum. C. Visible chest rise. D. Allow chest to recoil and compress at correct rate and depth. Answer D. High-quality CPR depends on rate, depth, full recoil, and minimal interruptions. During two-rescuer CPR for a child, what is the correct compression to ventilation ratio? A. 30:2. B. 15:2. C. 10:1. D. 5:1. Answer B. Two-rescuer child CPR uses a 15:2 ratio to balance compressions and breaths.